Good morning. My name is Benedict Westphalen. I'm part of the ESMO social media working group, and I'm very happy to have Claire Turnbull, a MAP 2020 Congress officer, with me today for a short video. Claire, one of the key messages that we saw during the MAP 2020 Congress was that cancer sequencing by larger panels has really become a working horse in managing cancers. However, we're still not really covering the germline usually, and how tumor-only testing can inform us as oncologists with regards to the germline and hereditary cancers. Could you maybe elaborate a little bit on that?
Thank you, Benedict. That's an excellent question, a very topical issue, and as you say, came up in almost every session at MAP. We are doing more and more tumour testing, but people are anxious about the germline implications, and that is unnecessary. The tumour testing should be undertaken to inform the management of that patient's cancer there and then. That's absolutely essential. With regard to the germline, there are, I think, three important issues. First, you need to have a clear pathway that involves your molecular pathologists and your clinical geneticists. And it may be a two-stage pathway, it may be a one-stage pathway, but you need to have nailed this out. I think the most appropriate pathway is two-stage. So you only just sort of let the patient know up front that there may be something found in the germline, and you will talk to them about it if it is. And you only bring in your germline testing downstream for the subset of patients for whom it's relevant. So point one, pathway. Point two, there are going to be a handful of genes in which it's really important you follow them up. And for that reason, we, led by ESMO, we issued a guidance, a set of recommendations in 2019 from an expert panel in which I was involved. And we gave some recommendations around germline focused analysis, because actually, even if it isn't relevant for that patient's treatment, if you find a mutation in certain genes, for example, BRCA1, BRCA2, in the tumour, it almost inevitably is germline in origin, and that may be important for their future cancer risk. And thirdly, there are a lot of other genes where if you see something in the tumour that looks like it could be germline in origin, it almost invariably isn't. And those are genes like TP53 and APC, BHL, because they're so frequently mutated in tumours. So again, that can cause anxiety where almost inevitably it is not necessary. So don't let fear of the germline inhibit your precision oncology management and your rapid return of results. Have a good pathway for germline focused analysis, involve your geneticists in the pathway, and look at our 2019 guidance.
Thank you so much, Claire, especially for that call to action. I guess all questions are answered. We're going to highlight your great paper.
Thank you very much, Benedict.